Hi, and welcome to the Expanded School Behavioral Health Program Back to School Training for the school year 2021. Today, we're going to talk about the Evidence-Based Assessment, or EBA, initiative overview. So those of you who have not had to participate in the EBA previously can have an idea of what it is, why we do it, and how it works. So what is the Evidence-Based Assessment, or the EBA? The EBA involves using assessments that are reliable, valid, and clinically useful for the intended population to facilitate data collection at regular intervals. And we use that data to inform diagnoses, treatment planning, and outcomes, and ongoing progress monitoring to inform changes in treatment. Why is it important? We're asking you to do something that can seem like an extra step. So the EBA is important because it helps us reduce bias and improve accuracy, which is really key when we want to develop a system of care for our youth and families that is anti-racist, that is equitable and accessible. It also supports data-informed decision-making in schools. This is really critical when we're deciding how to utilize limited funds to place clinicians in different areas, and also make sure that we're using those funds responsibly to get good outcomes in schools. EBA is important because it is also associated with greater treatment success, and we can see that through the data, and it supports school behavioral health quality and accountability. So when we're doing outcome monitoring and program evaluation, there's tier 1, 2, and 3 that we're looking at, and of course tier 1 is screening to all students, tier 3 would be a few students, and in the middle, tier 2 is some students. For this upcoming school year, we are going to use the PSC 17, and we're requesting each clinician at a school complete the PSC 17 with 6 students that they newly enroll for that school year. We will have a timeline that is coming out to you shortly that will provide dates for when this data collection will occur. The PSC 17 is also known as the Pediatric Symptoms Checklist. It's a psychosocial questionnaire that has 3 subscales: attention problems, internalizing problems, and externalizing problems. The assessment purpose is to screen and provide an initial assessment, as well as monitoring progress and treatment outcomes. There are 2 versions that are available. There is the parent version, which can be used for youth ages 3 to 16, and there's also a youth self-report version, which is available for youth ages 17 and 18. This can be used for youth who you can perhaps not have as easy of a time engaging a caregiver or a guardian. So why is this a great assessment? It's short, it's only 17 items, and it takes maybe 5 minutes to complete. We know that this can seem like an extra step, and we wanted to use a tool that not only is really good at collecting data, but it's also easy to use. It has strong reliability and validity as well. So it's been validated with certain populations. We know that the tool can predict academic failure, and it also has cutoff scores to indicate clinical risk. The tool is available in 4 different languages, which can be helpful depending on the languages that the youth and family you engage speak. It's very easy to score, and it's free. So when you get a copy of this presentation, there's a link of where to get the PSC 17 online. And so we recommend that you go to that website and you download the digital copy of the assessment tool for your own use. So when are we administering this? The initial assessment is going to be September to October. There's going to be a 6-week window from September 21st until October 30th. We call that our fall data collection window. Anyone that you enroll during this time period, we are asking you complete the PSC 17, and we're hoping to get that for your first 6 intakes during the school year. We know that the school year is going to be really hard. We're all starting remote, but we're hoping that we can still engage youth and families and complete this assessment with folks. A follow-up assessment of those youth that you were able to get data during the first window will occur later in the school year during February in our winter data collection window. And we'll make sure that we give those dates to you when we get closer to that time. Please note that youth ages 17 to 18 may self-report using the PSC 17, again, in lieu of the caregiver report. You can complete this during the intake assessment or via phone, or even send it out to a family to complete and return. And again, it's during that first window that we want to make sure we're getting those 6 intakes completed. So just some quick administration tips. This assessment tool is really meant to be individualized, and there are developmental considerations. So you want to take into account someone's reading ability. We don't want to send this out to someone who may struggle with reading to complete independently. It can be helpful, of course, to sit side by side, but electronically, when we're all remote, that of course is a little difficult. So sometimes doing this with a screen share and completing over telehealth can be helpful as well. Help the folks keep track of what question they're on while they're completing it. You can also provide visuals to illustrate their choices. So you can have a list that says never, sometimes, or often in order to have a visible list that they can select from. And you can also paraphrase items or give examples if they don't understand what an item means on the assessment tool. Other things to consider are, again, you can also complete this over the phone with anyone that is hard to reach. You want to make sure you're completing this in a way that is private and HIPAA compliant, as you all are, and making sure that you're keeping the results confidentially. Make sure that you're available if the youth or family have questions about the assessment tool, and you can gather examples and explanations as you go, which can help the youth and family engage in understanding the tool. Make sure you check that you've answered all the questions before you complete, and that only one answer has been provided per question. So these are some examples of introductions scripts for parents, and we're going to send out a copy of the slideshow so that you can have this for your tools. And again, we also have an example introduction script for youth, because 16 to 18-year-old youth can complete this on their own. Why is this feedback important? This tool will help us, will help you enhance communication between you and your families. They're doing the screening to see what symptoms are there, and that can also inform the clinical interventions that you are going to use in your practice. Using the tool can also improve youth outcomes, independent of whatever treatment approach you're using, because we're tracking progress. And participants are more likely to continue with counseling if they are in agreement with the clinician on the nature of the problem. So looking at the outcome of this tool and where things are, what are the most identified areas of concern, can be helpful in moving your treatment forward. We do ask that you not use jargon when you are trying to complete the PSC 17. Use language that the youth and family will understand. Trying to avoid acronyms or things that maybe are very clinical in nature can be helpful. And again, a feedback structure: ask, use, ask, provide, and emphasize. Ask permission to give feedback and information. Use a feedback sandwich: the strengths, needs, and strengths. Ask the parent or student to reflect on the information provided. Provide psychoeducation and suggestion on the next steps. And emphasize autonomy and self-directedness. This is really intended to be completed by the youth and family independently. One quick tip as well is you want to make sure that when you're completing this assessment that you are completing it on paper or saving the copy for your records. That may look a little different with the digital era that we're currently in, so you may complete a digital copy that you save for their clinical record as well. And that is the tool that you are going to use to enter the data into our EBA database. I'm going to pass this over to Magresh Patel to tell you a little bit more about that.
Hello, everyone. Thank you, Heather, for introducing about these EBA assessment data collections and why it's important. So today I'm here to show you how to collect this data on digital basis on our website. Since years, we have updated the EBA inside the ESMH. So those who know how to use ESMH websites, they can easily go and collect this data directly as for the EBA data. So first of all, as you can see here that on the slide, we have a bhsbaltimore.org website where you can find the ESMH service, means ESMH website, and, under the database login. And next here is, as you can see here, the survey menu on your screen. Besides the student menu, this survey menu will be available when we are going to be start to collecting the data based on the period that we decided. It will be not throughout the school year, it will be not show up, but for the particular 6 weeks that we decided, the menu will be automatically pop up, and then after you can start your survey. So once you click on survey, Those clinicians who have access on their schools, as you can see here now, please select the schools, means those who have access on the schools, they can select their own schools. Underneath, the number of students will be pop up, and then after you can start your intake date, caregiver relationship, and other information that asking over here. On the next screen, it will be continue all the questions about this, and then starting with this PSC 17 questions over here, where it will be a same exact the format that you will download from the link that we previously had, that is this show you. So one by one, you just enter the questions and feed all this information for the student who need EBA, and just save the data, continue and save it, and send the survey. That way the data will be saved into our ESMS database, and from that we will be continue doing our analysis. Plus, after 3 months, this survey menu will be available in a winter collection data time. So that time you will be see again this menu, but before the winter, means after October to December, this menu will be automatically disabled. It will be disappear, and no clinician can see those menu. That is over to you now. Thank you, guys.
So thank you guys for your time. We look forward to you engaging in the EBA initiative with us while we collect the data, and we will provide a separate overview so you can actually see the results of that data every year. Thank you and good luck.